Well, I asked Niall Dickson, who's the chief executive of the NHS Confederation, why he thinks these targets are being missed.
Well, I think two words really: rising demand. We've got more people across the UK, we've got more older people, and we've got more people with a range of different long-term conditions. The truth is that we're all living longer, we're having more unhealthy years as well as more healthy ones. And, it's interesting also that over the last 20 years or so, you're more likely at any age to be admitted to hospital. So hospitals are seeing a pressure which they've never seen before. And we've just gone through 9 years of the lowest levels of funding increase that the NHS in all parts of the UK has ever seen in the whole of its history. So a combination of those two factors, I think, make it enormous pressure, very difficult to cope with, and with a workforce which is frankly not of the size or indeed of the shape to try and deal with the new and rising demands that the service is facing.
So is there any point in having targets at all? I mean, do they just put more pressure on people in the service?
Well, in England, they are looking at the targets at the moment, and I think it would be wrong just to give up the targets because they're not being met. On the other hand, it's a nonsense to say we're going to achieve this when you know perfectly well that you're not. I think the targets have to be valid, and you have to say on what clinical basis is that target. So, for example, we have the 4-hour wait in accident and emergency, and if you're achieving 1% less than that, in order to get that 1% better, you may have to devote huge amounts of resource just to get that small extra bit, which may not actually be worthwhile. So that targets can distort the way in which people respond. On the other hand, I think it's perfectly reasonable for patients who, all of us as patients, pay for the NHS. I think it is reasonable that we set reasonable limits for how long people should wait, either in the short term in something like an accident emergency department, or how long we should wait for a routine operation. And I think in particular the ones that people probably worry about most are the speed of diagnosis of things like cancer. And again, the reasons why some of those become difficult are quite complicated, and they do need to be addressed. And I know that there's a lot of thought going on at the moment in England and to a revision of the current cancer plan to try and speed up that process so that we're better at diagnosing, because, of course, earlier treatment means better chance of survival.
But is the gap greater then between the initial onset and diagnosis than between diagnosis and the first treatment?
Well, that would vary according to the condition and everything else. And of course, some of it is about public education and the ability of, the willingness of people, when they have symptoms to go along to their GP and so on. But I think the evidence suggests that some other countries are managing to treat people more quickly, and we've got to understand where there are any blockages in our system. Now, some of that may be around public education. I mean, there's been some really good work that's done, very, very simple stuff on putting things in car parks to test people in relation to lung cancer, and if you put those trucks, as it were, into beside supermarkets and in areas of high deprivation, you can actually improve very significantly the identification of people with early symptoms of lung cancer where it can actually be treated and they can survive. But of course, if they don't go and get that treatment, then obviously it's usually fatal.
And where is there room for effective pressure here? Does this all point back to the Chancellor and effectively more funds, more money for doing health better?
Well, we're certainly, I don't think, if you look at the English example, and they've started to reveal some of that, but the Chancellor has announced money, in effect, for the whole of the UK for health over the next 3 to 5 years, and then saying in England they'll have a 10-year plan. And they are now starting to put in more money, quite a lot more money than they have done in the past. I think the difficulty is, first of all, how do you catch up again? Because we've fallen behind. We're no longer, as these figures show today, we're no longer meeting the kind of levels and standards that we were in terms of speed of access to care. So we've got to catch that up again. And at the same time, we've got to deal with even more rising demand over the next few years. Now, the government has promised 3.4% more every year in England over the next 5 years, and then saying there'll be more money thereafter. But the reality is that even that will not transform the service. The evidence that we compiled using the Institute for Fiscal Studies and the Health Foundation suggested that you'd need at least 4% a year every year for the next 10 to 15 years in order to try and transform the service. And we're not going to have that. So I think we've got to make the best of what we've got. I don't think this Chancellor certainly will be giving a lot more money. I'm not sure, frankly, whether other political parties would actually give more. I think it depends on the nature of the economy and the decisions that people make. But I think the health service has to say, well, we're doing better than most other public services. And we're certainly doing a lot better than social care. And I have to say that is, even from the NHS side, that is our huge concern at the moment, because the amount of money that's going into social care, particularly in England, is completely unsatisfactory. And of course, that's having an effect as well, because that means people are stuck in hospitals and they can't get out into the community. They're not being treated in the community effectively, and therefore they're ending up in hospital. So a lot of these hospital problems are caused outside of the hospital, and you have to look at the whole system and think again about how these services are organised and run.
Niall Dickson from the NHS Confederation, which represents the hospital trusts in England and Wales.